Welcome, everyone. Thanks so much for joining my presentation today. My name is Fatima Karaki, and I'm chair of the nonprofit organization Refugee Reach, which stands for Refugee Research Equity and Collaboration in Health. Our mission is to improve refugee health through building an evidence-based and refugee-led research framework in collaboration with refugee researchers, advocates, and the community. And I'm so excited today to share with you our journey from academia into the nonprofit world. We do this work because of the rising number of people worldwide who have been forced to flee their homes. As you can see here, last year there were 123 million forcibly displaced people, including 44 million refugees. And I initially got involved in this field because of this picture here, which is a picture of a Syrian refugee living on my family's farm in Lebanon. I started as a physician volunteer providing medical relief and ended up founding a very successful program at UCSF called the Refugee and Asylum Seeker Health Initiative, or RAHI. At RAHI, we published cutting-edge research in refugee health, helped build the infrastructure to make our field refugee-led, and hosted an annual symposium that attracted hundreds of attendees. And clearly being in academia was initially a blessing, but over time it became progressively more limiting to our work and was preventing us from realizing our mission. The fact was that we had simply outgrown the academic setting, and to continue to innovate and expand, we needed to move on. And so my team took the tough decision to spin out as an independent nonprofit and to leave academia in order to achieve our true potential. So while that was a necessary move, it was also a very daunting task. For me personally, having been in academia my whole career, I was worried that I wouldn't have the skills to succeed in the nonprofit world. So I decided to apply for the leadership journey specifically to help me face that challenge and to achieve this goal. When I arrived at immersion, I was initially very intimidated because all the other women I met were working for massive, far-reaching global organizations, and I was the only person I saw who was starting something small and independent. So initially, I suffered from quite a bit of imposter syndrome, even to the point where I asked Shireen if I was the right type of person that they were looking for. But as we moved through immersion and worked together, I discovered what we all know is the most valuable part of the journey, which is the other women in our cohort. Their feedback helped me to refine our mission and vision, hone in on our true expertise as an organization and what we had to offer. So many women in my cohort offered their professional advice and resources from their own careers, and I'm so grateful to them for supporting our success. Through the rest of the year, going through the leadership journey really helped to keep me on track and accountable for achieving our goals. I developed our theory of change and set forth the organizational priorities that you can see here. The touch points during the year helped me to develop my leadership skills and offer that to my team. I also looked at WomenLift Health as an organization and saw the parallels between its evolution and the evolution of Rahi. And I learned a lot of valuable lessons from the path of WomenLift Health, and we consider them to be a wonderful role model for us. I worked with my coach to develop a very detailed timeline for each individual area that our nonprofit had to achieve certain goals. So you can see that we worked in the legal area with our attorneys to file all the necessary documentation with the IRS. We developed our board, created our executive committee, and also created our charter and bylaws. We worked with our IT team to develop a new website, and we also recruited a new brand strategy team that helped us to completely rebrand and develop a new marketing strategy. So we're no longer known as Rahi, but we're now known as Refugee Reach. And I'm happy to report now at the end of the journey that we have achieved or are very close to achieving all of the goals that you can see in this timeline. And so by sharing this journey, I hope it's clear that my project wasn't just designed to fulfill a requirement for the program. WomenLift Health was actually central and vital to the success of our organization and our launch as a nonprofit. And I'm so grateful for the opportunity because we couldn't have done it without you. And moving forward, our organization has clearly navigated a lot of change through this journey. All of it has been in an effort to ensure that we're tailored to the current needs of the refugee health community and strategically positioned to succeed. For my own professional life, I was able to obtain a certificate in nonprofit management in order to gain the skills that I needed for this position. And I think that all of the investment in my leadership paid off because I was also recently elected as chair of the International Society of Refugee Healthcare Providers. So I'm currently chair of two different nonprofits. And at this point, looking to the future, We've finished all of our paperwork and we're awaiting our formal 501(c)(3) status from the IRS. We're so excited for our next steps to catalyze change in refugee health, and we hope that you'll continue to follow our journey as we grow. You can sign up to receive updates from us at our website, refugeereach.org. Thank you so much for your support.